Hey everyone, and welcome to today's Explainer. I am absolutely thrilled you're here with us. Today we're exploring a profoundly fascinating and honestly deeply human side of the pharmaceutical industry, the human core of quality assurance. We hear so much about processes, systems, and metrics all the time, but today we're focusing on the beating heart behind all of those systems. Okay, let's dive into this.
I really want you to picture this raw, incredibly emotional scenario for a second. Imagine the intense pressure of a health authority inspection. The auditors are finally packing up, that stressful final meeting is wrapping up, and the verdict is delivered: 0 observations. Nothing wrong. Now imagine looking over at the quality leader in that room. Have you ever seen tears welling up in their eyes at that exact moment?
Well, I have. Take a moment to just let that sink in. This isn't some hypothetical situation we're making up. This is a very real, lived moment that happens in the quiet, high-stakes rooms of pharmaceutical manufacturing. And those tears? They tell a story that goes way beyond any standard operating procedure. Because you see, those tears are absolutely not welling up out of a sense of corporate relief. They aren't crying because they hit a quarterly KPI or, successfully navigated bureaucratic red tape. Those tears represent a profound validation. It's the emotional release of validating years of relentless hard work, of unwavering commitment, and a deep, unshakable dedication to patient safety. It's that massive realization that what they built actually works to protect human lives.
Section 1. The traditional quality systems. To truly understand the weight of that emotional moment, we have to look at the foundations. For years, our industry has built itself on these 4 pillars. We talk constantly about quality by design, embedding safety right into the architecture of our products. We focus on cultivating a quality culture. We meticulously apply risk management. And, of course, we drive continuous improvement to make sure tomorrow is always better than today. These are the necessary business-as-usual foundations, and rightly so. We absolutely need them. Let's move to Section 2, the age of automation, and see how this builds.
The landscape of our industry is shifting rapidly, right? We're currently living in this incredible new era defined by AI, automation, and digital transformation. Our capabilities to process data and streamline manufacturing are exponentially greater than they were even 5 years ago. It's a thrilling technological paradigm. However, amidst all the servers, the algorithms, and the automated pipelines, there's another incredibly critical dimension to quality that we are completely overlooking.
Which brings us to Section 3, defining quality by emotion.
This is the core concept of today's Explainer, and we really need to start treating it with the exact same intellectual weight and legitimacy that we give to quality by design. Quality by emotion is the essential human drive that compels us to protect patients, support our teams, and genuinely care about the work far beyond just following written procedures. It is literally the invisible force that actually animates all of those rigid systems we talked about earlier.
So, the crucial point is, how does this emotion translate into tangible, everyday actions? Well, emotion is what drives a technician to protect a patient they will never, ever meet. It's what gives a manager the empathy to support their team through a devastating failure. It's the bravery required to learn from mistakes instead of sweeping them under the rug, the relentless drive to improve processes every single day, and most importantly, it's the profound integrity to do the right thing, especially when no one is watching. No algorithm can replicate these deeply human actions.
And this speaks directly to your sense of purpose in this field. Quality is not built by procedures alone. Look, a binder full of standard operating procedures is literally just paper until a human being interacts with it. Quality is built by people who genuinely care about the outcome of their actions. The procedures are the roadmap, sure, but human care is the engine.
And this brilliantly illustrates the distinct boundary between our new tools and our enduring humanity. AI can absolutely help us analyze massive data sets, and automation is unmatched at improving our operational efficiency. But technology has strict analytical limits. Neither AI nor automation can replace the human emotion behind quality. Only humans can genuinely care, and only human care can build authentic trust. Which leads us to Section 4, the patient's trust. Let's zoom back in now to the individual human level. Think about the exhaustive, rigorous, and, let's be honest, sometimes exhausting steps of pharmaceutical manufacturing. Think about the thousands of hours poured into a single run of medication. At the end of every single batch we mix, at the end of every complex investigation we conduct, at the end of every nerve-wracking inspection we sit through, and at the end of every single decision made on the factory floor, there is a human being waiting. There's a patient trusting us with their health and often with their very life. And that trust they place in us, it isn't a metric. It isn't a data point on a spreadsheet. That trust is fundamentally emotional. They are trusting that the people who made their medicine actually cared enough to get it right.
Now, what's really interesting about this slide is how perfectly it summarizes our entire analysis today. Quality by design builds the system. And yes, we absolutely need those systems to be flawless. But quality by emotion, that is what gives the system its purpose. Without the emotion, the system is empty. With it, the system saves lives.
So I want to leave you with this final provocative thought. Look back over your own journey. Have you ever experienced a moment in your own career that reminded you why this work truly matters? Think about your own why. I really hope today's explainer has inspired you to reflect on that and to bring that quality by emotion into whatever vital work you do tomorrow. Thank you so much for joining me today. Keep asking great questions, and I'll see you in the next explainer.